Chapter 8, Children with Emotional and Behavioral Disorders. For much of history, individuals with emotional and behavioral disorders were feared, poorly treated, and greatly misunderstood, often considered to have demons or being possessed by some evil spirit. In the late 1800s, Itard, who had studied deafness, and Séguin, who established schools for people with special needs, became some of the first to investigate treatment options for individuals with emotional and behavioral disorders. And in the post-World War II era, the responsibilities for children with exceptionalities shifted in general from medical professionals to educators in teaching environments. So children with emotional and behavioral disorders may internalize their difficulties, and these would be those that would be categorized as emotional disorders, or externalize them, and these individuals would be categorized as having behavioral disorders. Children may exhibit difficulties differently than adults. For example, oftentimes children's behavior related to depression can be the opposite of what we'd expect, and they may become aggressive rather than introverted. Cultures also have different perspectives regarding appropriate behavior. And so what's appropriate in one culture may not be appropriate in another. And so that influences definitions of behavioral disorders. The key aspect of this that we need to really think about is that it's the intensity and the duration of their difficulties and not how they are manifest that define emotional and behavioral disorders. And so how much does it interfere with their everyday life, and for how long has it done that? The federal definition of EBD does not reflect research and complicates intervention approaches because that often affects how schools can approach providing services. It assumes that some children who are acting out can simply change their behavior, and that may not necessarily be so. And it also neglects the role environment plays in emotional and behavioral disorders. So, federal definition of emotional and behavioral disorders is exhibiting one or more of these characteristics over a long period of time. Inability to learn that can't be explained by intellectual, sensory, or health factors. Inability to build and maintain relationships with peers and teachers. Inappropriate types of behavior and feelings under normal circumstances. General pervasive mood of unhappiness and depression, and a tendency to develop physical symptoms or fears associated with problems. So if we look at our information processing model, then you can see that overarching all in regards to emotional behavioral disorders would be the emotional context and its effect on executive function. And then you can see the associated issues with attention. It can interfere with vision and hearing processing, and olfactory, which is smell. In regards to thinking and processing, it's going to interfere with all of these processes: memory, classification, reasoning. And then under response, information output, it's going to affect their communication abilities verbally and in written forms. And then, of course, their social interactions. So let's look at some of the types of these disorders. So externalizing disorders, which would be, remember, the behavioral component, would be conduct disorder, oppositional defiant, disruptive disorder, obsessive compulsive disorder, antisocial personality disorder, attachment disorder, paranoid personality disorder, narcissistic personality disorder, schizophrenia, psychotic disorder, pyromania, and then bipolar disorder. So factors associated with these externalizing disorders or behavioral disorders include incidents of family violence and abuse, neighborhood and social violence, cultural mismatches, or cultural acceptance of these types of behavior, low academic achievement, bullying, and substance abuse. So if we look at this chart of child aggressive behavior and adult aggressive behavior, you can see that when we talk about juvenile arrest, red would be chronic or high, green would be moderate, gold would be increasing, and then blue would be non-aggressive. And of course, as you'd expect, high and moderate would be more likely to be arrested. And then increasing and blue has the lowest arrest rate. And then in regards to adults, same kind of patterns, but not as high of a percentage as for juveniles. And then when we look at aggressive behavior in conduct disorder, you can see that it's even higher than the arrest record. Again, for our red would be high, and then green would be moderate, and then with conduct disorder and also with antisocial personality disorder, you can see that the aspects of increasing and non-aggressive are much lower for those two categories. Now let's look at the internalizing, which would be the emotional aspect, and the disorders related to the internalizing component would be adjustment disorder, panic disorder, anxiety disorder, eating disorders, depressive disorder, elimination, which would be encopresis and enuresis. Encopresis is bowel movements, and enuresis is urination. Separation anxiety disorder, identity disorder, mood disorders, somatic disorders, which have to do with body health, tic disorder, and then Tourette's disorder. So internalizing anxiety and depression, some issues related to that is children who are anxious and withdrawn are more likely to be a risk to themselves than to others, so they're not likely to be aggressive. Although remember, sometimes depression can be exhibited with aggressive behaviors. Learned helplessness is common, the belief that nothing can stop bad things from happening, and the idea that you have no control over your environment or anything in your life. Children with internalizing disorders are at a higher risk for suicide than others because of that learned helplessness. So related then to the aggressiveness that we've been talking about, there are three actors in bullying with different motivations. And we're talking about the externalizing disorders and then the internalizing in relationship to bullies. And these are repeated physical and social harm against peers, but are not bullied by their peers. And you would assume logically that these are the externalizing disorders. Victims identified as routine recipients of bullying by peers but do not bully themselves could be those in the internalizing category, but could also be typically developing peers as well. And then bully/victims, these are those that bully others and or bully themselves, so a mixture. And observers of bullying and victims are also negatively affected by bullies, even though they don't bully or are not victims themselves. And so here's a chart of the percentage of students bullied and injured from bullying and by grade. And you can see that it's higher in 6th grade for those bullied as far as bullying itself, and also the injured. But both the bullying and the injuring tend to go down at pretty similar rates as children get older and are in higher grades. So outcomes for children with emotional and behavioral disorders, as with any special need, early identification and intervention is key to preventing negative outcomes for children. Unfortunately, if there isn't that intervention, half of students with EBDs drop out of school, and 25% will be arrested before leaving school, and we saw that in our data from the chart we looked at. And half will be arrested within a few years of leaving school. So when we look then at our RTI model for students with emotional and behavioral disorders, we can see at the primary prevention level, this would be students with serious problem behaviors, and 80 to 90% of these are provided services within the primary prevention area within the regular classroom, and this would be universal interventions, school-wide system, classroom systems, where their special needs would be addressed. The secondary prevention level would be students at risk for problem behaviors, 5 to 15%, and this is specialized group environments and at-risk systems. And then the tertiary or prevention, the top layer, this would be 1 to 7% students with chronic and intense behavior problems, and this would be specialized individual interventions, and this would be an individual student system. So curriculum and instruction with students with emotional and behavioral disorders. The universal design for learning strategies can help students with EBD access curriculum, including the Common Core curriculum. Effective interventions, with those you want to address both behavior and academic concerns. Intensive social skills training may benefit some students. And then using cognitive strategies or problem-solving strategies and skill development can be used to help them self-monitor, self-evaluate, self-instruct, and self-reinforce. Peer tutoring can also be helpful for academic assistance if tutors are giving training and support. So looking more closely then at those cognitive strategies with self-monitoring, this is documenting a specific behavior in a predetermined amount of time and looking at ways to intervene or to improve that type of behavior issue. Self-instruction training focused on sequential thinking skills like problem solving or managing anger. Self-evaluation, compare behavior to an established criteria. And then self-reinforcement is a structured self-reward system for improving behavior and developing skills to control behavioral issues. Functional behavioral analysis, or FBA, This is one of the techniques that can be used with emotional behavioral disorders. This focuses on why behavior happens and circumstances that happen before the inappropriate behavior or the antecedent behavior. And so some reasons, some things that can help with this is social attention, material and activity reinforcement, and then sometimes the cause for this type of behavior might be to escape or avoid something that's going to happen afterwards. And so those are things that might influence inappropriate behavior. Also, applied behavioral analysis, or ABA, it's sometimes also called the ABC approach. Again, we're looking for some sort of antecedent or something that comes before, and then the behavior that might happen, and then C might be a consequence. So you could either, from this approach, perspective, you could modify either the thing that came before or the consequence that came afterwards in order to change the behavior that is the problem. Skinner's operant conditioning approach involves focusing on the behavior that is wanted, or the appropriate behavior, and reinforcing that or strengthening that behavior by providing some sort of positive reinforcement or negative reinforcement. With positive reinforcement, this gives the child something they like, and so it needs to be observed what the children like. This is provided when they do the things you want them to do, such as give the child a hug when they pick up their toys. Negative reinforcement is not punishment, but what it is take away something a child does not like when a child behaves the way you want them to, like wash the dishes on their night to do that task because they cleaned up their toys without being told to. Please note that punishment focuses on when a child behaves in a way adults do not want them to, and often ignores the behavior we want. And it's not the same as negative reinforcement, which focuses on the appropriate behavior. When we punish a child, we take away something they like, or we add something they don't like, which is really the opposite of reinforcement and operant conditioning. So the families of children with early emotional and behavioral disorders often need emotional and social support themselves, and should be provided with resources of how to access that support. Viewing parents as expert partners is beneficial to all involved because it can provide you with long-term expertise on how the child behaves and what comes before and after, and also the long-term influence in a child's life. So providing them with information can end up with positive outcome. And what happens after school? A child leaves the school environment is difficult. It's difficult to secure support services and resources. And these resources, if they're found, are often limited in duration. So that makes it a challenge, and of course would be one of the things that affects arrest later in life and negative outcomes later in life, and possibly self-medicating and resulting in substance abuse issues.